I'm Dr. Vibhu Kawatra. I'm a pediatrician. I am a pulmonologist and an allergist. I have my own practice in Nagar in Delhi, and apart from that, I go to various corporate hospitals as a visiting consultant. The coronavirus is actually it's just another virus which is there and causes the respiratory infections, and it has been there in the environment since a long time. It's not that it has not been there. But this time it has come into focus because of the higher mortality and the morbidity rate which it's having. And probably the reason is that just another virus is actually being used in kind of biological warfare, as a result of which it's creating so much of trouble. So, like as I said, like any other respiratory virus, it can cause fever, it can cause body aches, it can cause colds, it can cause cough, it can cause stress, that is difficulty in breathing, as well as it can cause, in severe conditions, it can cause respiratory shutdown. It can lead to doing of that can occur only in the most severe cases. Otherwise, in most of the cases, it's just a respiratory infection, and in a lot of cases, we may not even diagnose the case. As I said, had this not come into the focus, it has been there since a very long time, and probably it was not in our focus because it was not causing so much of troubles. So it might be possible that thousands of people would have been infected. They went through it and they got all right, and it was over. It was never really diagnosed. Now it has come into focus because of the lethality of the virus which is there, and this the strain which is there is called the novel coronavirus right now. So this new strain which is there of the virus, that is what is causing the trouble. So these are the symptoms, and these are the symptoms which can be there with any other respiratory viral symptoms. So it is nothing different from other viruses. It's just that it's like the other viruses. It's just that it can cause more severe symptoms. Like in influenza, also, if you see, or in the swine flu, it's a similar kind of a thing. You see, in last 10 years, if you just go back to the history of the 10 years, and in my practice in 10 years, what I've seen is earlier it was for last about 4 5 years, what we are dealing with was first the dengue we were dealing with. Then we were dealing with the influenza virus, which is the swine flu virus, which was there. Now, what happened with the dengue? Initially, the dengue was very lethal. It was causing a lot of breakdown of the platelets, and a lot of symptoms, body symptoms were there. Then eventually, the things started getting better. And if you see last 2 3 years, whatever patients we see, most of them dengue comes out to be positive, but there's not much of fall of the platelets and not very high temperature. So the things, it's just that we are aware of the condition. That's why we investigate for it during that particular season, and we move accordingly. The same thing happened with swine flu. Now, swine flu again came in, but swine flu, it's a well-known fact that it's a severe kind of a virus, so it causes troubles. Now, this coronavirus was just a simple respiratory virus case. It was just it causes the common cold and common coughing kind of a thing. And in very rare cases, it can lead to a bigger problem. Now, the novel coronavirus which has come, the newer strain which is there right now, there are a lot of news reports that it's being used as a biological weapon. Now, what has happened is that probably in the labs, this viral virus, there has been certain changes in its structure, and that has actually led to its longer persistence in the body and causing of the more severe symptoms as compared to what it used to do commonly. So if you see the old records, the coronavirus used to cause the mortality was less than 2%, which means the less of the patients actually died. The morbidity, the severe morbidity was less than 10%. So I would say that 90% of the cases would just pass off. And I'm talking of the 90% of those cases who have been proved as coronaviral cases were actually sailing through like a normal cold and cough. But now the morbidity has increased. Now, if you see how many of them get diagnosed, so if you see 2014 to 2019, suppose we see the 5 years, probably out of 100 cases, only one was investigated, and then out of that one tenth of that one was actually getting severe. So you can imagine that way. Now we're getting more cases because it has come that somebody with the coronavirus is actually landing up with more lethal condition. So that is the main problem. So that's the newer virus being different is because of the biological which has occurred. It can be even not even a part of biological warfare. It may be just that there's certain things called antigenic drifts and antigenic shifts. That is, a virus changes its structure over a period of time. So it could be a natural thing also. We can't right now. It's too early to comment upon it. Right now, no, I would not say you can be really immune to it. Although I was reading the newspaper today, and in Australia there is a person of Indian origin only. They're trying to build up the vaccine for the coronavirus. But if you just see, whatever news we have is what gets published in the newspapers, with what gets published in the by the WHO. So that is the news which we are reading, and we are also going through it. So the kind of changes which we have occurred, what we have read is like they have kind of injected this virus with some RNA of the HIV also, which is leading to the structural changes very fast. So in case it's actually true, in case it's true, then in that case I would say it's going to be a big, massive problem, because the structure will change so fast that it would be difficult for us to really develop a vaccine. But if it's a normal antigenic shift or drift, the natural thing, then probably we might expect a vaccine soon. But that soon, usually, when we talk of soon, it's about a year, not before that. So the WHO is not really commenting too much about its structure part, but what it said is that it's much more severe, and the morbidity is much more higher. When we talk of morbidity, it means the severity of a disease. So it's like somebody having a cold and cough is fine, but somebody with a cold and cough, then with inflamed lungs, is not able to breathe, gets bluish discoloration of the body. Now that gets called a severe thing. So the respiratory failures and the respiratory distress is much higher. The requirement for tertiary health care, which is like the hospital care, has increased. So obviously there is going to come a point, because the researchers are going on. Apart from that, obviously it's going to cause a lot of panic in the public. So right now the thing is, whatever you can do, just keep yourself safe. That's the only thing. There are a few things which you can do. The first thing and foremost thing is use a mask. A mask becomes the first thing, because at the end of the day, coronavirus spreads. It's from the animals to the humans, and from the humans to the humans. It's occurring. And apart from that, the new thing which has come about the coronavirus is that it's aerosol based, which means that I'm talking to you right now, but I'm talking across on the computer, so you can't get a coronavirus if I have it. But in case we are sitting just right across each other, and it's even at a distance, then I can, if I'm infected with the coronavirus, I can spread it to you, and it can occur up to about 14 days after the diagnosis. So that's a pretty long time. The best part of it is save yourself. That's the first thing. Keep yourself safe. Keep mask. N95 masks are the best ones. Although there are reports that even surgical masks are good enough, but I would say that keep it safe. Keep it at N95 masks. They're the best ones. They keep yourself safe. Then apart from that, adequate hydration. Then frequent washing of the hands and utensils and whatever you use. Apart from that, you need to keep a watch. It's like as a citizen, as a responsible citizen, it is that you can around your place who is having any kind of a respiratory distress, which is kind of prolonging, or it's something unusual. You can always tell that person that, look, get a medical attention, or at least wear a mask. I mean, you are infected, but you are not going to infect the others if you're going to wear a mask. But if you're not wearing a mask, wherever you're breathing, you're actually throwing virus. So it can spread actually very fast. So that's the main thing. So when you talk of the treatment, we only talk of supportive care. So mask you have, washing of hands, keeping everything neat and clean, maintaining the hygiene, maintaining adequate hydration, maintaining the airway. That they are the basic things which you have to just maintain. It's more of a symptomatic thing and more of a supportive thing. Even if a patient goes into a severe condition and goes to a hospital, what does the hospital do? It's like people panic and go to the hospital and say that something unusual is going to occur. No, right now what is going to happen is you might get some antiviral drugs. So that's what I said, that there are the changes are there, that it's having some HIV thing and all. Those news are there because anti-HIV drugs are being used to contain the virus. But at the end of the day, the virus has its own life. Now, when you say it has its own life, as I said, it's about 14 days after you are diagnosed. Now, those 14 days, probably if you're going to take the medicines and all, it might reduce it to about 10 days. But 10 days, you'll remain infective and you'll remain on that danger zone till everything. It's with any virus. It's not with the only coronavirus. So let's not panic with coronavirus. It's with any virus whatsoever. Dengue, you say that okay, once your 7 days are over, thank you, you're happy. 7 days of fever, eighth day you're probably on the safer zone. After eighth day, usually the things get settled. With swine flu, it's about 14 to 28 days. So that is, so every virus has its own kind of a life. So this virus has a life of about 14 days. So that is something which you have to just pass off. Is being very clear that first of all you have to be responsible. That's the most important thing. And I think it's, when I talk of you, it doesn't only mean that you as such, the person who is not infected, rather the person who is infected also should also be even more responsible, because he should understand that fine, he got the disease, but he's somebody who is a potential carrier and a potential kind of, I would say, he's a terrorist. He is the one who can spread this virus like anything in the environment. It multiplies, like one person gives it to five, and another, those five is going to go up to 25, and 25 to 625. It's going to expand like anything. So that's the most important thing, that you need to be more responsible with the things. Apart from that, your own safety, your own masks, the hygiene and everything that you need to do, your adequate hydration. If you have any symptoms whatsoever where you have a little doubt about it, please contact your doctor immediately, because you might require, even it's like I said, the adequate hydration. You may not be able to drink much, so in that case you might be requiring IV fluids and all, so that at least your kidneys get saved, your complications get less. Apart from that, as I said, as a citizen, it's your duty that in case you have any doubt of people around you having this virus, please inform the authorities immediately, so that that person can get medical help, and the society around him can actually get yeah, in a safe zone, as compared to what he's going to do if he's going to be moving around in the society. Obviously he's going to be spreading the virus. So this is what you can do.